HIV/AIDS is destroying our families. It is destroying our people.
Unicef is well placed to stop the spread of HIV/AIDS because we've had 50 years experience working with children and families and community on health and education and welfare issues.
If each and every individual takes it upon themselves, HIV/AIDS can be stopped.
Once thought of as a disease that only threatened intravenous drug users, homosexuals, sex workers and their clients, HIV/AIDS has spread through every sector of the population in every region of the world. Unicef, the United Nations Children's Fund, has a range of life-saving programs designed to stop the pandemic and assist those whose lives have been ravaged in its wake. 17 million children have lost one or both parents to AIDS. UNICEF provides support in the form of healthcare, nutrition, education, and protection to orphan children. And UNICEF supports preventive education programs, empowering young people with the knowledge to protect themselves. One of the most painful consequences of the HIV/AIDS crisis has been its effect on mothers and their babies. Over 15 million women globally are HIV positive, and most do not know if they are infected. Not knowing that they are HIV positive clearly endangers their lives, and it threatens the lives of their future children as well. But there is hope. Pregnant mothers can turn to a UNICEF-assisted program for the prevention of mother-to-child transmission, or PMTCT, where they will get counseling, HIV testing, and medication support for themselves and their babies in the form of antiretroviral therapy if they are found to be carrying the virus. Without help, 1/3 of babies born to HIV-positive mothers would themselves be HIV positive. But with the prevention of mother-to-child transmission program, that number is lowered to only 2%. Giving birth to a healthy HIV-negative baby felt like a miracle to Noella Umuhoza, who lives with her 3 children in Nyamata, Rwanda. But to truly create a healthy, empowered life for herself, she needed more. When I found out that I was HIV positive, I was afraid to tell anyone. I kept it a secret because I knew my family hated people with AIDS. When they discovered that I was HIV positive, I was immediately rejected. But then, a Zonta International supported program changed her life. My new family is the association I belong to, where other women like me gather to support each other and learn skills to make an income for ourselves. In the past 2 years, Zonta invested $600,000 to help women like Noella build the confidence and self-esteem to develop into the positive, productive women they deserve to be. Partnering with the Mbutu Foundation, headed by First Lady of Rwanda, Jeannette Kagame, Zonta funds have been used to assist HIV-positive mothers at health centers around the country.
Zonta support has helped UNICEF provide key services to pregnant women in Rwanda who come into a health center and find out that they're HIV positive. And these services include treatment, counseling, psychosocial care, and even advice on family planning, as well as providing them with a means to support themselves in the years to come.
The Zonta supported program is known as the Family Package, and its holistic approach has benefited Noelle and her 3 children in countless ways. The family has been given seeds, tools, and the training to create a garden brimming with healthy vegetables that increase their nutritional status and ability to fight disease. And Noella has learned to sew and been given the use of a machine with which she can now support her family. In another part of Rwanda, Rose Manirarora has faced similar struggles. She was devastated to learn that she had contracted the HIV virus from her former husband, and terrified of being stigmatized by neighbors, family members, and most especially, her new husband.
Often when a woman finds out that she's HIV positive, she doesn't want to share that information with her husband. It's a matter of shame, it's depressing, they're traumatized. And what the Family Package program tries to do is to involve men. Because when you involve men, it's not only about the woman, it's about the couple, it's about the family. And when a family is together, when a husband and wife understand an issue, then they can work on resolving it together.
Thanks to Zonta and UNICEF's support, families like Rose's are intact, strong, happy, and healthy. The Family Package and my association with everyone there really makes me happy, really strengthens me. When you are with others, you're not alone. I love the machine they've taught me to work on. This tool helps me to earn an income for me and my family. And now I'm eating well, and my family is eating well.
These income generation projects are really important because they enable the woman and the family to buy food that they might otherwise not have been able to buy, to provide better nutrition for their families, and also to pay for educational costs. So in that way, we're supporting not only child survival, but a better future for children.
Once again, Zonta has stepped up to the plate and is making a huge difference for women and their families. Zonta's support for the Family Package for HIV-positive mothers is both saving and changing women's and children's lives in a powerful and lasting way.